Welcome to our 2020 Levy Community Forum. Wow, I cannot believe what a year 2020 has been. None of us could have imagined how this pandemic could affect nearly every aspect of how we work, live, socialize, and simply try to get through our daily routines. Tonight, we look forward to sharing with you how the Levy program can help you or your loved one move beyond from just getting by and merely surviving to actually thriving in this new normal in which we find ourselves. I think at this point, many of us are getting used to this online environment, but just as a reminder, as you come into the meeting, if you could mute your microphones and turn off your cameras unless you're speaking, that would be really helpful with our connection. But with that said, we welcome you to put any questions or comments into the chat, and we will do our best to address them throughout the presentations. And then at the end of each session, you will also have an opportunity to ask questions. And at that point, we'd ask you to unmute your phone and turn on your camera or put the question into the chat. We would all love to be with you in person. We want to hear from you. We welcome and encourage your feedback, and we want to know how you're doing in this crazy new normal. By way of introduction, I am Amy Becerra. I am the Levy Program Director at Rocky Mountain Human Services.
Funeral.
I
Are you on plate number 2? One time.
But from the state government side of business, and I have very much enjoyed my associations with the people we serve and the providers that work with them. I value the work done by community-centered boards and was so excited to join the RMHS team in May of this year. Yes, right in the middle of this pandemic. I only recently met my own team in a park, socially distanced, masked up, so that we could prepare for tonight's meeting. With that said, I'd like to take the opportunity to introduce you to my team that's joining me here tonight. I am joined by Lindsay Krings, our Levy Program Manager, Abby Grinstead and Erin Allen, our Levy Program Development Specialists, and Nicole Mays, our Levy Coordinator. This group truly adopts the mission of RMHS as they work every day with our program teams and external partners to embrace the power of community, to support individuals and families in creating their future, and in this case, within a new normal. The advantage of the Levy program is that it allows our team the flexibility and resources to truly carry out the organization's vision to simplify access, celebrate individuality, and bridge communities. I am amazed by the stories I hear on a near daily basis of how the Levy program has been able to do just those things. I'm excited for you to get to know more about our program and team throughout tonight's sessions. When I learned about Levy many years ago, I thought, what in the heck is Levy? I kind of think we need to come up with a new name. But in the simplest of terms, Levy refers to a portion of Denver property taxes dedicated to supporting the children and adults with developmental delay or intellectual and developmental disability that live in Denver. Levy funding in Denver is not new. In fact, it's been around since 2003 when it was passed on the Levy ballot. But over the last 5 years, RMHS has really fine-tuned the Levy funding and transformed it into a robust, person-centered program. As I said, Levy offers flexibility that our state and federal programs often cannot due to limited, rigid, or prohibitive rules and regulations. RMHS leverages that flexibility that is inherent in Levy funds. Through these funds, we are able to empower Denver residents with IDD to directly access Levy funds to meet their individualized needs. We are able to support individuals' unmet needs through wraparound services and external community partnerships that provide unique IDD services and support that would otherwise not be available. We also provide additional support across programs and departments within RMHS to eliminate wait lists, enable service coordinators more time to work with clients, and enhance clinical programs. Even in the most normal of years, we realize that the IDD system is extremely complex. Families are often faced with navigating multiple systems and can be at a loss of where to get the services they need to support their loved one. COVID-19 has brought on an additional layer of so many new challenges, and I know many of us are feeling overwhelmed with rising to the occasion. Regardless of what the current state of affairs is at any given time, the RMHS mill levy goals remain constant. We are here to increase access to services. We are here to offer flexible service and provider options, and we are here to meet individualized needs. So I want to tell you about Gustavo and how mill levy was able to impact his life. So Gustavo was able to see for the very first time in his life through an individual request submitted for highly specialized visual assistive technology not covered by Medicaid. We are so grateful of what levy funding can do for individual lives. This is only one example, but demonstrates the beauty of mill levy. The mill levy program is dynamic in meeting the most current and relevant needs at both the community and individual level. It is the simplicity of mill levy funding that can cut through complexities to fill gaps, enhance service coordination, and meet individualized needs so that people with IDD can live their best life even during the most uncertain times. You want to go to the next slide? You can go to things. I would be remiss if I didn't do a shout out to our incredible community partners that represent 27 distinct projects funded by mill levy this year. Annually, RMHS issues an RFP, and community agencies have the opportunity to request mill levy funding to deliver innovative and relevant projects to Denver residents with IDD. The RMHS Community Advisory Committee, the CAC, identified 7 areas for priority funding, and all of our current projects address at least one of the priority funding areas, which include basic needs and environmental supports, behavioral and mental health services, education and increasing independence, medical and dental services, social and recreation services, training and support, and IDD system gaps and assistance across other programs. These partners, if you want to go to the next slide, these partners have amazed us this year. They have wholeheartedly embraced the spirit of mill levy and made adjustments to their program to deliver on the goals of the mill levy program, even during a pandemic. We encourage you to visit our website and take some time to learn more about these impressive partnerships and the direct services and supports they can offer you. Next slide. We are committed to seeing that mill levy funds are used to enhance people's lives. We are proud of the program we've built that offers flexibility, creative solutions, individual requests, relief, and many options. Our goal is to maximize the mill levy funds to ensure that every Denver resident with IDD has been offered a mill levy service plan, and to reach as many Denver residents not accepting services through RMHS as possible. We do this by keeping our administrative costs lean while complying with the parameters and requirements set forth by the Department of Human Services to utilize these funds. Let me introduce you to another client that benefited from the mill levy program. Meet Jeff. It had been years since he'd seen his mom. Serious health issues had forced her to move out of state, where other family members were able to provide her with assistance. Traveling back to Denver was out of the question. Jeff had his own obstacles, including the financial aspect, as well as needing a travel companion to provide supports due to his low verbal skills and challenging behaviors. The mill levy team joined forces with the community partner to find a solution that would allow Jeff and his mother to be reunited. Since Jeff loved animals and liked to walk, it was ideal that his mom lived near Yellowstone National Park. It was the perfect setting for their reunion. Accompanied by his companion from our community partner, Jeff embarked on his first plane ride to reconnect with his mom at her home. The trip of a lifetime was all made possible by Denver taxpayers who generously provide funding to people with developmental disabilities. So tonight, we recognize that we are living in this new normal. I think all of us, when the pandemic hit, thought it would be around for a short period of time, and then it kind of hit us in early summer that it wasn't going anywhere, and now we're settling into what does this new normal look like. We're excited to offer, you want to go to the next slide? We are excited to offer the following sessions this evening. focusing specifically on how Levy has been able to address the needs that have been highlighted during this global pandemic. For those of you that would like to attend our sessions focused on successfully living and learning at home, you will stay here in this Teams meeting link. The second session will be offered in Spanish. Por los que quieren asistir a la sesión de familias y niños, van a quedarse acá en este enlace, pero va a empezar la sesión de español a las 7. Entonces, está bienvenido de asistir a la otra sesión en el otro enlace, pero está en inglés. O puede quedarse acá por la sesión en inglés, pero vamos a repetirlo en español a las 7. Our other 2 sessions will be offered through the link that will be given into the chat shortly. Our adult services session will focus on filling the gaps and technology supports available through Levy. That'll start at 6:15 promptly. At 7 o'clock, our session with one of our community partners, Financial Health Institute, or FHI, will focus on an exciting addition to the supports they've been currently providing through our external partnership. This session is relevant to not only adults receiving services, but also for caregivers and families navigating this new virtual world we are living in. So I invite you now to follow the link, and we will promptly start our sessions as we move over to, if you want to go to the adult sessions, click on the link that Joelle just put into the chat. And if you are staying for the children and family session, you'll stay right here. Following the 2 sessions, we will return to this main link just for closing remarks and any questions and comments that you would like to provide.